Recent studies have shown an increase in incidence in younger patients. We're seeing a rise in rectal or colorectal cancer. We really don't know what the cause is, but colon cancer is still most commonly seen in patients above the age of 50, but we suspect as medical oncologists that we're going to be seeing more and more younger patients over time. Colorectal cancer screening in the United States has decreased the risk of dying from colon cancer by about 30%. We diagnose a lot of these cancers at an early stage when they're very small things called polyps in the colon, and these polyps can progress over time to turn into cancer. And the easiest way to cure cancer is really catch it very early, and basically you avoid a big surgery or chemotherapy in the future. So screening earlier may capture more patients at an early stage where they don't have to develop cancer in the future. So the American Cancer Society recommended any patient with average risk obtain two types or two forms of screening. One is a stool-based form with high quality stool tests like immunohistochemistry of the stool, blood in the stool, and there are some DNA tests that you could use in the stool. They also recommended the option of visual or structural evaluation of the colon, which would include basically colonoscopies, sigmoidoscopies, or tomo visualization or imaging of the colon. Average risk is the average population. High-risk patients are usually patients that have high risk family syndromes like Lynch syndrome or FAP syndromes. Those patients have to be screened way before 45 years of age. But average risk, they're really talking about the average population. What they're recommending is every patient between the age of 45 to 75 have their routine screening, and the duration depends on what type of screening you use. At the age of 75 to 86, it's a discussion between a patient and his physician. After the age of 86, they didn't recommend any further screening at that point. It's very important to talk about the risks and benefits of screening. So screening has, different screening modalities have different risks, and it's very important to talk to your doctor about what are the risks and benefits of procedures like colonoscopies and sigmoidoscopies. And you also, at that age, you might have to think about your other medical problems. They may be more dangerous than cancer at that point. So that's why it's very important to talk to your doctor during that period of time to see if you would be a person that might benefit from a screening procedure like a colonoscopy or a sigmoidoscopy. This is the American Cancer Society guidelines. We have different governing bodies in the United States. The main body is the United States Preventative Task Force, and their recommendations stand still at age 50. There's no doubt anyone above the age of 50 has to get a colon cancer screening, but doing it a little bit earlier, I think, is probably where most people are leaning towards at this point. But I think we have to listen to all of the governing bodies before we make a major decision. And these are discussions between a patient and their regular doctor to see if they really should go ahead for screening. A lot of patients may not have symptoms from colon cancer, but the main symptoms from colon cancer include blood in the stool. That's very important, and that should be discussed with your doctor every time. A lot of times, blood in the stool could be a benign disorder like hemorrhoids, but if it continues or recurs, this has to be discussed multiple times with your regular doctor. Other symptoms include fatigue, feeling really tired, maybe not being able to exercise like you used to, that is just abnormal and persistent. Other symptoms include abdominal pain. Sometimes these tumors can become really large and cause some blockages, which could cause cramping in the abdomen. This should also be evaluated by your regular doctor. And sometimes patients are diagnosed by routine blood tests. They go to a regular physical and they have something called anemia or low blood counts. That also has to be fully worked up by their doctor to make sure that they're not losing blood and don't notice it in the stool.
I went in for appendicitis twice, and then they ended up doing a hernia surgery. And then I started getting a lot sicker, so I had some lab work done, and it came back, my hemoglobin was 5.6, so it was extremely low. So they did a colonoscopy and found I had colon cancer. So my case was a little different because I've been screening, because my father died when I was 30. When he was 30, I was 5. He died of colon cancer. So I had been screening since I was in my late 20s every 3 years. But I have a condition called Lynch syndrome, which accelerates the growth of the cancer in the colon, and you're high risk for other cancers also. So for me, I had been screened, but my doctor was not aware of the Lynch syndrome. So that's how I ended up with stage 4 when I first went in. So then I did chemo, surgery, and chemo. And I'm now 1 year, 3 months off chemo. I've met a lot of people that now are maybe battling colon cancer, and I've met through the system that it could have definitely changed their outcomes of if it would have been 45. You know, I have some people struggling with it, and I've lost a good friend to colon cancer under the age of 50. So had it been 45, it absolutely would have changed their outcomes, absolutely. I know it would not have mine, but I know my case is not that common, you know. So I truly believe 45 is maybe not even early enough, but it's better than 50. It was hard. But for me, I'm the kind of person you just get in and you get it done and you fight. I knew I had a lot of support. I have a lot of friends, a lot of family, supported. They were there every treatment, my husband, my family, my kids. I just would never want, if they can prevent more people going through that, because it's not something you would ever want somebody else to have to go through. So the earlier the screening, the better, catching it earlier. 1 year and 3 months. I just had my 1 year and 3 month checkup.
And how are you feeling now?
Great. It's the best I've felt in years, obviously. So colon cancer, if checked, it's very easy. The polyp is removed. It's a very preventative cancer. If people would just follow the guidelines or really watch symptoms, you know, of that maybe something going on. A lot of my friends that were maybe right at 50 hadn't really had their colonoscopies, and after that, I mean, they're very, very adamant. They go in, they do it regularly. I really didn't change my schedule all that much. I took every other Friday off of my schedule. Actually going to work, and they're all my friends and my supporters. It kind of helped me through the tough time, absolutely. It was a blessing more than a job. It's much easier, yeah. You take life for granted until you are sick and you're in the middle of something like that, of, you know, cancer and chemo, and your life changes. It rules you. You know, you don't have the freedom to go do whatever. You don't feel good, you know. You do what you can to survive, And so it's so nice now. It just feels like a whole new freedom and I'll probably, hopefully, I'll never take that for granted again. They say people that are overweight, they smoke, they don't exercise, they're high risk for this. I never smoked. I exercised regular. I was a fitness instructor. I ate good. Go get checked. No one is exempt to cancer. Get the screenings. Do what you can to prevent, changing your life forever. I'm just really happy they have changed those guidelines and that there's so much more awareness for colon cancer. I'm just very happy it's out there. It was amazing. The doctors, the nurses, I had the best care. I never questioned, my care or how I was being taken care of. They get back with you right away. They were just a blessing in my life. So pretty much it's about lengthening and strengthening, stabilizing the core.